Hi guys, welcome back to Tuesday Tips with Back to Health. My name is Dr. Zoya Reznik. Today we're going to talk a little bit about frozen shoulder. Basically touching upon what frozen shoulder is, what we do here with physical therapy, what you can do at home, and how to identify it. So with a frozen shoulder, there are two different types. There's the primary and there's the secondary adhesive capsulitis. Let's talk about the primary first. With a primary adhesive capsulitis, it's basically a self-limiting process. It starts on its own, and it has its own game of plan basically. So it goes through 3 different cycles, and basically once it passes through 3 cycles, that's when it gets better. So with a primary frozen shoulder, those that are at higher risks are the ones with diabetes, have a higher risk of developing it. Otherwise, it just happens for whatever reason. So basically, there's a certain pattern that it goes through. There are certain limitations in the movement that we identify to help us understand if it's the primary or the secondary. So the capsule is the first stage is basically the freezing stage. Capsule is being frozen in a certain pattern. So the front of the capsule followed by the, under the capsule followed by the back of the capsule. As it goes through that first stage, the motion starts being limited by pain. So you can't move the arm in any direction because of pain. Then it goes into a frozen stage. The frozen stage is basically everything's frozen. The capsule is not letting the joint move as much. The muscles are tight around it. So the pain starts getting better, but the motion is more restricted by stiffness. So you can't move in certain directions because everything is tight. The third stage of the primary frozen shoulder is the unfreezing stage. So everything starts to relax basically. You slowly start regaining the motion, the pain subsides, and the movement becomes more free. Each stage by the books lasts about 3 months, give or take. However, it's very individualized. I've seen some people go through 2 years, I've seen some people go through less than a year, so it varies. Now what can you do as you're going through those stages? Again, because I said it's a self-limiting process, not much that we can do to help make the process go a little bit faster or improve the range of motion through each one of the stages, because it still has to do what it has to do. So through those 3 stages, the main goal is managing the symptoms. Putting on the heating pad helps. It helps increase circulation to the area, helps make it feel better. Doing pendulum exercises helps. With physical therapy, we work on passive range of motion to maintain what you have, so not to let it get worse over time. There's been a lot of research that looked at different therapies within the primary adhesive capsulitis. And they compared, if you go aggressive joint mobilizations versus gentle passive stretching versus not doing anything at all. In the long run, it doesn't really matter. The aggressive joint mobilizations does not make it better in the long term. Does not improve the range of motion. As you're going through it, it might get a little bit of, give here and there, but then it's going to go back because it still has to go through each stage. So when we really get involved is once it goes through its 3rd stage. Once you start regaining the range of motion, that's when we focus on regaining the strength, because the muscles have been in one position for a long period of time. So they're on the weaker side. There could be some tightness in the capsule, residual from the adhesive capsulitis. So that's when we really work on range of motion, maybe joint mobilizations, strengthening exercises, so you can regain the full use of your arm. So that's the primary. The secondary adhesive capsulitis, basically following a trauma. So let's say if there was a fracture and you were in one position for a long period of time, if there was a surgery on the shoulder, you were keeping it in one position for a long period of time, what ends up happening, certain parts of the capsule surrounding the shoulder joint get stiff. The pattern, it would not follow the actual pattern of the primary adhesive capsulitis. So you would not see certain motions limited more than others in a predictable way, basically. In that case, we can use more aggressive approach to help improve the joint mobility and help improve the motion. In that case, any kind of range of motion exercises, stretching exercises, strengthening exercises to help improve the mobility. So just knowing that difference and knowing what to expect between both of the pathologies. Again, keep in mind, if you have the primary adhesive capsulitis, which the doctor can diagnose or a PT can diagnose, it is going to take a long time. It's not something that we can fix overnight, unfortunately. So just being patient as we go through each one of the stages. If it's the secondary due to prolonged immobility or trauma or whatnot, then that's something that we can fix fairly quickly, hopefully not as painless as possible, and get you back on track. So just think about those things. Hopefully you don't have to deal with it, but if you do, keep that in mind. We as PTs, again, we address both. Depending on what's going on, we will have different approaches to it. So that's about it. Yes?
We have a question.
Sure.
Can you show a basic self-exercise for frozen shoulder?
So frozen shoulder, okay, if it's the primary, let's say, you will have less motion going this way. This is the first motion to go, and this is the most restrictive motion, so rotating out, followed by this motion, followed by this motion and reaching behind. So think about which motions are limited. Again, as I mentioned, with a primary frozen shoulder, you don't want to push through pain. So gentle stretching, for instance, if you have a cane, lying down, non-weight bearing position, holding the cane, you slowly use your left arm to push the right arm out. Go to the point where it's not as painful and just hold it there for a little bit. Then bring it back and just keep it moving back and forth. To improve this motion, again, lying down, cane in the hands, palms facing up usually, and you just use your left hand to bring the right arm as much as you can. Again, the first stage is really painful, so do as much as you can. Any kind of movement or walking up the wall can improve the mobility. What I like to give to patients is basically if you can get arm to the shoulder level, okay, standing with the shoulder blade back, and you're basically using your body to move through the motion. So either turning your body in to stretch the back of the capsule, or turning your body out to stretch the front of the capsule. And you could keep going back and forth, and it helps improve the motion and improve the mobility within the joint, or at least maintain what you have at that point in time. Pendulums are always the best bet. So bending forward, letting the arms just hang there, and just using the body and the momentum to get the movement going. The other way you could, if you can't do it actively, standing at a counter, for instance. So both hands on the counter or sitting by the counter and just moving backwards. So you still stretch the shoulder, not using the muscles, which can, it's not going to be as painful as doing it actively. So did that answer the question? Okay. So that's that. If you guys have any other questions, definitely let us know. If you found this video helpful, feel free to share it. Or, if you have anything, please call the front desk and schedule an appointment. So we'll see you the next time, next Tuesday, for Tuesday Tips. We'll see you soon. Bye.